Good morning. I'm Dr. Jayashree Gopal, endocrinologist from Chennai. And this World Diabetes Day, November 2024, I'm going to talk to you about the impact of diabetes on various stages of life. It uniquely impacts people across the different life stages, whether it be children who are diagnosed with diabetes or during pregnancy, what is called gestational diabetes, or in older age. And let us have a look about what are the unique aspects of management of diabetes at different age groups and what are the aims of managing diabetes in each age group. Obviously, when diabetes is diagnosed in children and adolescents, it is important to monitor their blood sugar levels and manage whether with insulin if it is type 1 or with other medications if it is type 2 diabetes. It is critical to manage their blood sugar levels well so that they grow properly. And they need to be educated on healthy habits, healthy living early on in life. Regular physical activity for the youth is very important. This not only helps to manage their blood sugar levels and maintain a healthy weight, but they're also less stressed. During adolescence, the hormonal changes of puberty can cause problems with significant insulin resistance and a loss of blood sugar control. This is not helped by the peer pressure that comes into play at this stage and the stress of examinations and leaving school, entering college. So at this point in time, continuous glucose monitoring, emotional support are critical for effective diabetes management. When diabetes is diagnosed during pregnancy, so-called gestational diabetes, pregnant women are very concerned about the impact on their baby. But with a judicious following of a balanced diet, regular exercise, and usage of medications as necessary, both mother and baby have optimal outcomes. The pregnant woman should not forget that they need to continue to monitor their blood sugars after delivery because they are at higher risk of developing diabetes later on in life, even if the sugar levels have come back to normal. And continued lifestyle changes and proper adherence to diet can postpone this. When we come into older adults with diabetes, the focus changes slightly. One, they face more complications, particularly those related to the nerves or to the eyes or to the heart or to the kidney or their feet. So it is essential that they have regular medical checkups. Medication adherence is very critical at this stage because quite often they would have had diabetes for 20 to 30 years and there is a sense of lethargy creeping in and they forget to take their medications. There is also an issue related to finances. Quite often people in this stage of life are retired and they do not want to spend money on medications. It is also important that we keep in mind that adjusting medications for the elderly is important because they're more sensitive to diabetes medications and they are more prone to developing low blood sugars or hypoglycemia, and this impacts them worse than if the low blood sugar occurs at a younger age. Older people with diabetes are at higher risk of cognitive decline, both due to poorly controlled diabetes and also because of other concomitant factors like aging and high blood pressure and cholesterol. So managing the blood sugar levels in a safe range, staying physically active and eating a healthy diet and maintaining an active social life can help maintain good cognitive function. At all stages of diabetes, it is important that we offer people with diabetes both emotional and mental support, whether it is for children and for that matter, their parents who've been diagnosed with diabetes or pregnant women diagnosed with gestational diabetes or for elderly individuals dealing with other long-term care health needs. The education and self-care has to be individualized at every stage, and not only the person, but also their caregiver, their family, their loved ones, their friends need to be brought into the sort of the whole arena of diabetes management along with the healthcare providers. And this is crucial for maintaining a good quality of life with diabetes. I hope what I've mentioned in these last few minutes, you find it helpful, whether you have diabetes or you have somebody living with you who has diabetes. And just go out and make sure that you lead a full life. Don't let the diagnosis of diabetes stop you. Bye-bye.